Surrey Memorial Hospital. That is for special care, the special care nursery, and whether that has any background to this discussion or not, I'm told it isn't. That gives me some comfort. But I just say to you, politicians are in the end the people that fund the purse that runs your hospitals, it runs your healthcare system, and in the end that's who's accountable. Thank you.
Okay, we have about 10 minutes left, let's say. So, yes, ma'am?
My name is I worked 32 years at Meadow Hospital. I just recently retired. I was the clinical chief of physiotherapy at the hospital for since 1989. For a long time. I can tell you that I'm very proud of the hospital, or I wouldn't have stayed there for 32 and a half years. One concern that I do have is because of the size of the pediatric unit, our physiotherapists, and I can only speak for physios, are generalists. They are not specialists. And what I would like to see, and any service that we did give to maternity was many years ago discontinued. We would see a neonate if we needed to, but we don't always have the expertise that is required to give the appropriate care in a community hospital. We would definitely be in touch with our colleagues at other facilities should we need to do that for any reason. But I can tell you that there are no pediatric physiotherapists on staff at the hospital at this time. There is not the cutoff for a pediatric physiotherapist to be at the hospital. What I would like to see and what I would like to suggest is that Fraser Health actually has an excellent education program that is provided to their staff for a nominal fee sometimes and oftentimes for no fee. What I would like to see is grand rounds, and anybody that is interested in pediatrics, whether they be physios or other staff, is that they participate in grand rounds, and that does not mean you have to leave the site because they have the ability to plug into the different sites so you're not losing time by traveling. And I would really, really like to see that we become more proficient at keeping our pediatric and neonates in our own community in that way. If we don't do that, then it is not always in the best interest of the patient to keep them in a facility if the staff are not up to date with the treatment that is required for that patient. So that's just, I would really like to see Fraser Health do grand rounds.
Thank you. All right, anyone else? Yes, ma'am?
Our wide spectrum of public stakeholders and families and patients, parents and children were invited to come and to speak to us. From that, they generated 41 themes of issues that we felt we needed to work on. That public involvement actually led to us coming up with 12 goals that we felt were important for our program. And so there is public consultation in part of the work that we've engaged in. We've now engaged in making a commitment to bring that back so that our sites can all input into that and make sure that it's the right vision that we want. And part of the vision is being family-centered, but also in having a connection to the public. So one of the things that grew out of that visioning process was the commitment to have family councils. There are family councils in other services, but we really desire to have one within the Mickey program because we know that the feedback from the public is very important. And we will work on making sure that there's a way to do that that's intentional so that every community can have input into the family council. And then the senior program leadership team from the maternal and child youth program will have a responsibility to respond to those needs. That's a responsibility that we've put on ourselves. We've decided that we will be responsive to the family councils that we establish, and we will be looking for representation from communities, and they will be the public that will be responding. I am an obstetrician. I am very well aware of the fact that obstetrics works in surges and slows. And part of what you need to do when you build a system is that you have to build capacity for the surges. I think we were all aware of the fact that there was a point at which high-risk mothers and neonates were being transferred out of this province, and it was because although we had capacity, we didn't have the capacity for the surges. Therefore, we have worked very hard to help the government to understand that and for there to be an investment and an increase in beds. And there was an increase in beds in Fraser Health. And in fact, we will be going to a provincial table to say we need more increase in Fraser Health because we don't have the number of beds that meet our population. So whenever there's a future increase, it shouldn't go into BC Children's, it should go into Fraser Health. And we would hope that by 2020, which is in 10 years, we could have increased the capacity for our own high-risk moms and babes to have their service in Fraser Health, as well as our capacity to be part of a provincial system. So we are well aware of the fact that we need surge capacity, and in fact, every hospital that we currently have is part of our surge capacity, and that will absolutely be part of the decision-making process that we look at as we look at this problem. We know those issues. I know those issues because actually I need to leave right now, although I'd like to stay, but I need to go back and deliver babies tonight. And our hospital has been at capacity all day, and we've needed to transfer patients out, and we haven't been able to because they come in and they need to deliver within 10 minutes or half an hour, or there's babies in trouble. And so we not only do we